Ulcer. It is another broad heading under clinical examination or short case of surgery. And under that broad heading, ulcer, you will find many cases in your clinical placement as well as in your clinical practice. And one short case under that broad heading ulcer is must in your examination, whether it is undergraduate level or at postgraduate level. Namaskar, I am Dr. Anuj Dash. I am a general and laparoscopic surgeon, and today I am going to discuss some basic things regarding examination of ulcer. And before going to that video, I will request everyone to see the previous videos. And I again request that you should watch the video thoroughly, and if you find any questions you will ask in the comment section, as well as you will share this video, and you'd like to subscribe this channel for further updates. Now the front page introduction, and that front page picture is showing you that the frontline doctors has served the nation as well as the world in this COVID pandemic starting from the December 2019 and going till date. And I'm saluting to all of the doctors through my video. So if you have saluted the doctors, let's start our journey today. A disclaimer and warning shots. And the examination scenario, it is similar to previous examination scenarios, that you will go to your examination center and you will greet your examiner, as well as don't forget to greet your patient. After that, your teacher or examiner will ask you to examine the ulcer in anywhere. It can be in the leg, it can be in the face, or it can be in your trunk as well. And you will wash your hands or sanitizer. So at first we will discuss or we will classify the ulcer according to its etiology, or it can be termed as pathological classification as well. And the first etiology comes in our mind is traumatic. An ulcer can be traumatic, or it can be infective, or it may follow any infection, like it can follow a superficial soft tissue infection caused by Staphylococcus aureus, which will lead to a boil or abscess, and that abscess may disrupt, and after disruption that will lead to an ulcer also. What if you think in our GIT system, in stomach or first part of duodenum, Helicobacter pylori may cause gastric or duodenal ulcer. The ulcer can be diabetic also, and it is more common in diabetes mellitus patient. And that ulcer may be caused by a venous disease also, like varicose vein. An arterial disease may lead to an ulcer as well. If you find any ulcer in the distal portion of your limb, you may think that ulcer may be due to any arterial cause, and we need to ask some questions regarding that etiology. And some ulcer may be malignant as well, or carcinomatous, like squamous cell carcinoma, basal cell carcinoma, or malignant melanoma. And some ulcer can be specific, and the specific ulcer will follow a specific infection. And that specific infection usually follows two principles. First one is that specific ulcer will be caused by specific microorganism, like tuberculosis. The tuberculosis can occur anywhere from the hair to toe, but anywhere it occurs, it is caused by single organism, that is Mycobacterium tuberculosis. And second point is, if you look at the picture under the microscope, we will find a similar picture everywhere. Like the tuberculosis will produce tubercle, that will be surrounded by a Langerhans cells, and there will be caseous necrosis centrally. So that is the points regarding the specific ulcer or specific infection. And that ulcer can be non-specific as well. And that is the ulcer. We are looking at ulcer of our left lower leg. As in any other ulcer, it is ulcer carcinoma, it is a specific site. And look at the color, it's black color. It can be melanoma, it can be simple mole, or it can be ulcer carcinoma as well. Now, regarding the history, you need to ask some questions. And history is also similar to the swelling. Similar to the swelling, like you will ask that what is the problem? আপনি কি জন্য এখানে এসেছেন বা কি সমস্যার কারণে আপনি এখানে আসতে হয়েছে আপনাকে? Okay. Then the duration, the how long you're suffering from that problem. Then he or she will tell that it is long duration or short duration. Now, the etiology, how it happened. It can be traumatic or it can be infective or it can be vascular or venous or anything. Then you have to ask whether he is suffering from any diabetes mellitus or not. The progression, it is rapidly progressing or it is there for many days and progressing very slowly. Or you may ask for some symptoms as well. And then you will ask about the etiological questions, like if you find any swelling distal to the foot or in the toes, the artery will be first question, and you will ask about peripheral arterial disease, usually intermittent claudications. You will ask about whether he or she feels any pain in or cramping pain in her or his cuff muscles. The etiology can be venous, and you ask about the risk factors or predisposing factors for varicose vein, like the gender. The female, it is more common, and in female, the OCP is one of the cause, or it can there may be immunization history, or if that patient may suffer from any abdominal malignancy as well. Then the diabetes, whether she is suffering from diabetes mellitus and for how long duration, and whether that is controlled or not. If it is controlled, then with which diet or discipline or any oral drugs or insulin. And in case of malignant ulcers, you need to ask about the occupation or exposure to the ultraviolet radiation. Or if you find any ulcer in the wall cavity, you need to ask about whether he or she is a betel nut chewer or not. And I am mentioning it that all these things will be described in separate videos. So I am requesting everyone to see or subscribe my channel to get update of the further videos. And regarding the questions, that whether he or she is feeling any pain about that ulcer, or is discomfort or any functional impairment there. Now, say the most common ulcers you will be examined, you will given your exam is foot ulcers. So you know, in your short case we usually follow a principle like inspection, palpation, percussion, auscultation. But if the short case is or extremity, then the protocol changes, and protocol changes to look, feel, and move. And we need to examine with this broad heading. So first of all, what will we look? First of all, we will look at the legs. We need to expose the both legs, like he or she is having an ulcer in the right foot. Okay, you need to examine the left foot also. So you need to ask your teacher to give a stool, and you will ask the patient to raise his leg or place his leg in the stool, and both the legs in the stool, and you need to sit. That's why the eye level, your eye level will be at the level of the ulcer. Okay, so exposure and position is very important here. And if it is a venous ulcer, you need to expose up to the waist also. Okay, to look at the direction or extension of the great saphenous vein, the lower limb or lower abdomen also. Okay, so exposure is very important. How much to expose and what are the techniques of exposure, that is a separate issue actually. And you need to first of all look at the ulcer proper, the ulcer area, and after that you need to, if the ulcer is in flexor surface, you need to examine the extensor surface as well as the sole of the foot. Don't miss to look everything. Sole of the foot of the opposite limb, extension of the opposite limb, and sole of the foot and extensor of the affected limb as well. Then look for the deformity, whether there is foot drop or any hemato or any claw foot or anything, or necrodactyly. So look for the deformity. Okay, and look for signs of ischemia. You know, the signs of ischemia, it is possible for ischemic ulcer or arterial ulcer. There will be shining of nail, there will be transverse disease on nails. Okay, nail will be brittle, or the skin will be shiny, thin. Okay, the loss of hair. So look at the signs of ischemia. and look for varicosity, and the exposure I have stated. You need to expose up to waist or even beyond. So in abroad, the patient just wear the undergarments. But in Bangladesh, we need to examine our patients are very sensitive, so we need to take special precautions regarding the exposure. And also the pigmentation, like dermatosclerosis in varicose ulcer or ankle flare. And what we'll look at the ulcer proper. This site is very important, because site will click that ulcer can be of that origin. Like the varicose ulcer usually in the greater area. If it is a leg goes medial malleus, lateral malleus, the ulcer will be in the malleolar area, above or over the malleolar area. The arterial ulcers usually tip of the toes, the extremity, distal to the extremity. Okay, toes. The diabetic ulcers usually in the sole of the foot, or in the trochanteric area, or even in the interdigital clefts. Okay. The ulcer carcinoma usually occur in the angle of a line drawing from the angle of the mouth to. Okay. And tubercular ulcer usually occur in the neck. Now the size. You need to assess the size by looking, and you describe by adding approximately. And what is the importance of size? Size will help you to determine what the patient will need as secondary skin closure or any graft, or it will heal by. And the shape of the ulcer and the number of the ulcer, then the margin. The ulcer proper has got margin. What is the margin? It is a line demarcating the ulcer from the intact skin. So, for example, this is the intact skin, okay, and that is the epithelials have a disruption. So that point is called margin. Okay, and margin can be regular, irregular, ill-defined, or well-defined. Now the most important age, and age of the ulcer. This is the floor. The floor, that means what we see. Okay, what we see in the ulcer is called floor, and the area between the margin or skin or the floor is called the edge. And that edge of an ulcer will classify or will differentiate in different ulcers. Like there are 5 types of edge. First of all, sloping edge, that means that is the skin or margin, okay, and that is the floor. So that ulcer is healing from inwards. That's why there is there is wide gap in the skin but less gap in the floor. That is sloping ulcer. That skin thins out gradually. Found in where? Healing ulcer. Punched out ulcer. That means that there is tissue destruction equal in all direction to skin to bone. So there is the skin region, and that is the extension of the ulcer, that is 90-degree angle. Okay, it is punched out. That you will punch something out. There will be equal destruction and found as trophic ulcer. Now undermined ulcer. Undermined ulcer means that tissue destruction is more at subcutaneous level than the skin. So you will see small gap in the skin, but under the skin there will be more destruction. Okay, it is found in tubercular ulcer. Now raised and rolled. There is another thing that you will find, that the ulcer is proliferative lesion. There is a proliferative lesion, but it has not spreaded. Just it is a raised lesion. Okay, and the proliferating cells are called as beads. Okay, and is found in basal carcinoma. And in small scale carcinoma, the cells may grow rapidly and that will extend from its region, and that will be everted. So it is called raised and everted. So small cell carcinoma, it is everted edge, and basal carcinoma, it is rolled edge. Now floor, what it always we see. Okay, the exposed surface of ulcer, and the floor. This is the floor. You are seeing that is a healthy granulation tissue, lots of red things. Okay, and discharge also. We will look at the granulation tissue. It is very healthy. This is very red. and here is some whitish material over there, and also some reddish area. And this whitish material, it is called slough. And if you want to define the slough is defined as dead soft tissue. And what is soft tissue? Soft tissue is anything between the skin and the bones. Okay, it can be fascia, it can be nerves, it can be muscle, anything. And when it is dead, it is called slough, dead soft tissue. Okay, it is another ulcer. You look, this is the margin, because this is differentiating between the skin and this ulcer, and that is sloping actually. So there is wide gap in the skin, but inside that the gap is decreasing. That is sloping ulcer, but that is having some white sloughs as well. There is whitish area, and that red things is granulation tissue, and also there is discharge as well. So when we will say that this is healthy granulation tissue, look at the picture again. This red or pink. Okay, if I P actually you tell it, punctured hemorrhage, there will be hemorrhage, bleeding, and that is pulsatile, it will pulseful actually, and it will painless usually, and that bleeds on touch. If you touch, there will be bleeding, because that is caused by made up of capillaries. Now slough, it is slough, dead soft tissue. Also the granulation tissue can be exuberant. Okay, that is exuberant granulation tissue. We call it proud flesh. And you need to look at the surrounding skin as well. It can be inflamed. So that's all for today. We have discussed some basic things regarding the ulcer examination and what we'll look at inspection. In next class we'll discuss about the palpation or a few more things regarding the ulcer. So I think that today's discussion was helpful for you, and if you find it helpful, so please subscribe my channel as well as share with your colleagues as well. Thank you very much for watching.